This webinar series was prompted by our Standing Committee on Science for Poverty Reduction. We were reacting to the fact that South Africa has done well in its response to slowing the spread of COVID-19, as well as the mortality that could potentially have followed from infection. The situation currently unfolding in India gives us some sense of what could have happened. However, evidence is emerging that the success in dealing with the medical issues of COVID has come at considerable cost to livelihoods and well-being, and that this has disproportionately affected the most vulnerable, especially women and people living in precarious communities. We are seeing extreme hunger and outright desperation. This cannot continue, morally, politically, or from any other perspective. The resilience and patience of those most affected is running out, and their prospects of recovery are becoming increasingly slender. We must do something now to directly mitigate extreme poverty. We need to find a way to pay for this, and we need to ensure that all stakeholders are capable of implementing the strategies that we come up with. This webinar series is a contribution to finding a solution and to turning South Africa's considerable expertise in the measurement of poverty, the understanding of its causes, and the understanding of its dynamics into a societal impact.
So what I'm going to focus on today is what we can learn about poverty and inequality from the NIDS-CRAM. I'll focus on some selected results around employment, grants, education, and I'll speak a little bit about what that then gives us. Okay, so just to recap on what NIDS-CRAM is, it's a longitudinal survey, which is based on the National Income Dynamics Survey as a sampling frame. So we follow them over time. We ask the same individuals questions about their employment status, about whether they're recipients of grants, about their health, their mental health, and their physical health. The NIDS-CRAM data is freely available to all individuals. There are reports on each of the themes I've discussed here today, which are on the website, cramsurvey.org. So if we look at what happened to GDP over the course of 2020, but the key thing that we have to understand is what happened in Q2, because that was lockdown level 5. In Q3, we went to lockdown level 1 in October, but right at the end of Q4, we got to lockdown level 3 again. So the importance of this data is it shows us how our response to COVID through the lockdowns have impacted upon our economy. What we know from NIDS-CRAM is that poverty almost certainly increased. So we did see that inequality increased in almost every dimension. Those kids in private schools have continued to get online education. Those kids in public schools have lost out tremendously, both in terms of their education, but also in terms of their school feeding schemes and access to regular meals. The one crucial aspect of 2020 that defines our response to COVID is the increasing rollout of social grants. What was a tremendously successful aspect of our grant rollouts in the course of 2020 is the fact that 70% of adults received a grant in their household. So about 2/3 of all of these individuals receive a CSG and SRD in the household. So these were particularly well targeted. As we know, the immediate response to COVID under the level 5 lockdown was to top up the CSG, and that's because it was already in operation, it was already reaching a vulnerable group. We also saw that women have less emergency support despite being worse affected in terms of the care burden for children. And in summary, we saw that the pandemic magnified pre-existing divides between cities and rural areas on the one hand, and between suburbs and townships or informal settlements within cities on the other. The metros proved to be slightly more resilient to the initial economic shock than rural areas and cities and towns, and rural areas showed less signs and slower signs of recovery. A question that began to arise was, are rural recipients of grants in rural areas receiving too much support. And this led to a big discussion around targeting of social grants and how if you have multiple different grants, then the targeting of your communities can sometimes be very tricky to be able to identify and discern when you're looking at receipts of grants, right? And the implication is that government grants have definitely helped to offset unemployment and poverty in these townships and informal settlements. But very importantly, the premature withdrawal of social programs in these areas could lead to an exacerbation of hunger and extreme deprivation. To sum up then, what we have been able to glean from the data is that the grants have played a saving role for millions of South African families, and therefore we do need to think of ways in which they can be sustained and how we will be able to pay for them. There is a case for more targeted efforts to boost jobs and livelihoods in urban and rural areas. We know that the crucial change in 2020 was the rise in the number of grants and the number of grant recipients. And that really helped smooth out the welfare implications of the lockdowns. We do need to consider this idea of a universal basic income grant, but the question will be, does that then substitute for all other grants or not? In other words, does it mean that the CSG, the disability grants and others will all be phased out and only a universal basic income grant will be given? The fiscal policies needed to be able to afford this and evaluate its feasibility and sustainability. Finally, I would like to just talk about the importance then of thinking more broadly about these livelihood opportunities, because in places like peri-urban areas, in townships, in rural areas, each of these local geographies bring with them particular opportunities. We're increasingly becoming aware of how they interact with the environment, with waste, with health, how these things can be incorporated into expanded public works programs in order to better the local geographies at a micro level.
My name is Grace. I've been part of the NIDS-CRAM survey from the start. So I've been mostly involved in looking at questions on the evolution of hunger and food insecurity in particular in South Africa. So I wanted to just highlight two figures. We have a large proportion of this country running out of money for food. These red graphs over here show a respondent who answered yes to the question, did you run out of money to buy food in the last month? Comparable statistics from the GHS, which is another survey which can sort of give us an indication of lack of money for food, showed us that household hunger in the past year, in 2018, was around 25%. So for household hunger in the past month to be 47% in April is really a remarkable increase and something that we should be worried about. But I wanted to also particularly draw attention to child hunger in November and December. In the GHS, got the 16% statistic based on the answer to the question, has a child experienced hunger in the past week? If you approximate the GHS, in 2018, around 8% of households were experiencing this. So within a year, this statistic has doubled. In this paper, we also highlight the long-term impact of child hunger. Another indication of malnutrition is the diversity of a child's diet. Now, for 41% of households to run out of money for food, I would suggest that the 59% who aren't running out of money for food are still decreasing the diversification of their diet, which can also be a problem. So to move on to the final sort of graph that I'll talk to. Now, you'll recognize this 41% from the last slide. That is the proportion of households who are running out of money for food. So to look at the targeting of different grants, we said if the grant is targeting the right household, more than 41% should be going to those households. Now, the best targeted grants were the CSG and the old age pension. The old age pension is large, is very good at pulling a household out of food poverty. this really agrees with Riza around the importance of grants being well targeted. Child hunger is an incredibly large problem and will be for the next foreseeable future if we don't target child hunger in particular.
We know from James Heckman's work on early childhood development that if kids are not getting, especially in early parts of life, where some ECD centers will be focusing, they're not getting regular nutrition of the right quality, then their cognitive skills are affected and their non-cognitive skills are affected. And one of the great tragedies and potential long-term implications of our education policy during lockdown by having things like school closures is that we have had a material, nutritional impact upon the most vulnerable, which is children.
What I'm drawing on is work that myself and my colleague Stuart Ngandu have done, empirical baseline work in KZN as well as nationally on EPWP. And I thought it was really important that we lock into what is this understanding of EPWP's envisaged contribution and what is the theory of change, because we often forget to unpack the design issues and how they relate to impact evaluations. EPWP Phase 3 and Phase 4, very similar objectives, as you can see below here, about work opportunities, income support, labor-intensive delivery, and delivery of community assets and services. This is what's been expected as developmental impacts of EPWP. Wages are below market level. That's a very specific self-targeting mechanism, that there will be impacts from participation in work, skills building, employability, etc., and then impacts of the assets and services delivered, both in terms of the developmental outcomes, but also well-being outcomes for communities. There are three conflicting, sometimes conflicting, in fact, most times conflicting outcomes that public programs are expecting to achieve: sustainable livelihoods, skills development, provision of assets and services. The labor intensity of public employment programs is enforced on departments who already have a set of outcomes that they have to deliver. So yes, they have to deliver on X number of environmental programs, X number of children in care or ECD, etc. Who are these participants? And what is their education level? And as you can see, a lower level of education, and particularly people who started in the EPWP programs earlier, and the age, so above 36. If you look at those figures there, a very significant percentage of the workers had been unemployed prior to this program. More women being unemployed than men. Most of them had reported working in EPWP where they had got their first or second opportunity. So what was the monthly income, average monthly income from salaries and stipends? And the one that stands out there is the working for fire, greater exposure, slightly greater income levels. Overall, really concerning was the low levels of average monthly incomes. Slightly more than half of the participants reported that more than 50% of their income came from EPWP. The lack of household incomes is a severe problem. Child support grant remains quite an important source, although people who had subsequently exited the program, child support grants and pensions played a bigger role in their households. So yes, transfers do have a place, they do make a contribution, but they are not about eradicating poverty, and they're not even bringing people up to the poverty line. We found that household self-reporting was that the incidence of hunger in households improved due to participation. But essentially here you can see that food shortages persisted. When we did the Tracer study, what we found was, again, that of the 45% who indicated they were temporarily employed, 38% were full-time employed and 15% were employed part-time. But these were people who were unemployed post-participation. These were people who were employed but not in an EPWP job. And then these were another EPWP job, but not in DEA, in another department. You can see that in terms of the prevalence, which is the green line, the depth of poverty and the severity of poverty, high levels there as well. And again, poverty levels for women, depth, severity, etc., are higher than those for men. Overall conclusion is that, yes, it does have a socioeconomic objective of mitigating severe poverty, but it is not eradicating vulnerability and poverty completely, and that the impacts are stronger if you are participating longer. And there's very limited evidence, less than 16% reported labor market access, and almost no training outcomes in terms of employment. And I think the last point I'd like to make then is that we found that none of those outcomes were sustained post-exit from EPWP. Training, yes, we did an extensive amount of work around training, and what we found is a mismatch between what the market needs and what training was provided. So, for example, working for fire workers have developed extensive skills that ESCOM and Translate, etc., could use, which is occupational health and safety, trained people, as well as people who could work in high altitude. Unfortunately, the problem was that those programs were not accredited, and so then ESCOM and Translate, etc., could not employ people. So this is the kind of mismatch that we saw. Also, short-term training, so a 5-day or a 10-day training for EPWP primary healthcare workers or emergency, so when they were working as home-based care workers, was completely inadequate for the kind of qualification. The local supermarket actually reported having to employ more people because people had incomes. We had a little case study, for example, of somebody who was a mender. He was a tool handy person who would repair equipment, and he suddenly started to get more work because people wanted their irons repaired or their stove repaired, etc. So they definite multipliers like that. There was no use of electronic data by sort of cell phone data, etc. for logging in people's participation and then payments through that. It was all through bank accounts. And so many of the participants in rural areas, for example, right down in the Karoo, etc., were complaining that the cost for them to get to a bank or post bank, etc., to get their money was a significant problem.
Our task here today is to talk about the funding options and how do we finance the programs to alleviate poverty. We are obviously in this context, as we debated today, aware of our fiscal crisis because of the years of poor policy choices, low growth, the recessions that we had, the COVID pandemic on top of that. But we're also aware that we have not paid attention enough over the years of investing in social infrastructure and in substantive poverty alleviation programs. And on top of that, we can add the decades of corruptions and state capture, where a lot of funds that should have been used for this important task have been lost to help us really improve the lives of the majority of our population.
And certainly we need, in a sense, to be shouting as loud as possible as to why it is that the obvious solutions to the particular problem are the ones which we are failing to implement. Given the fact that I have absolutely no confidence that over the next 3 to 5 years, we're going to grow at more than 2.5% a year. And by the way, my lack of confidence is supported by all the figures beyond this year, because nobody's telling me that we're going to do more than, say, 3, if we're lucky. How do you fund, whether it be a basic income grant, which of course is more than worthy of careful consideration and implementation, and a range of other programs, whether they be public works, or alternatively, perhaps even more important than that, a kind of reversal of what seems to me to have been a kind of austerity program announced in the last budget. If you're going to assume constant growth, then clearly the natural course of tax collection increases are not available to you. So then the question arises, well, how do you get more money? And then there are only 2 solutions. One is tax increases, and the other is more efficient tax collection. I remain unconvinced that any significant tax increases, in other words, increases in the nominal rate, are going to get you the sort of money which is required in order to generate the finance for programs such as an overall basic income grant, a reversal of the general austerity in circumstances where greater forms of capital infrastructure can be implemented in terms of programs, or a public works program or any other similar form of program that in the shorter to medium run would alleviate the problems we have. Because you can run the numbers. You can run the numbers on a personal income tax. You can run the numbers on corporate tax. And then, of course, you get to the vexed problem of the wealth tax. The question which I think Professor Woolard and I, in a report that we did, raised as well, there's a whole range of issues that you have to put in place in order to implement a wealth tax, and then the comparative evidence does not indicate a significant sums of money, of the kind of money that some people claim.
So if we were to impose these three new taxes, the social security tax, which for all intents and purposes is really just more personal income tax. It isn't actually a different tax. And we take away the medical tax credits, and we impose this, and we take away the retirement contribution change. Our Professor Jones, for argument's sake, she's got 3 dependents. She pays medical aid of 8,000 Rand a month, so a middle of the road medical aid scheme. Under those 3 taxes, her take-home pay would go from 45,000 Rand a month, which is a very reasonable amount of money, down to 34,000 Rand a month. That's not a small change in her tax liability. It's a massive change in her tax liability. For the taxpayers that are being targeted under the scheme, these are not small tax changes. And that just makes me question how feasible it really would be to impose those taxes all at the same time. So let me leave it there and just say that in terms of a design for a wealth tax, there's a lot of work that needs to happen. I think we're a few years away from any of this coming to fruition. And so we then make some suggestions in the work that Dennis and I have done about, well, what could we do in the meantime? And one of those things we suggest is that at least put the building blocks in place to start designing a wealth tax. And at the same time, that would increase, we believe, that would increase revenue collections on the income tax side by ensuring that there's better reporting, both from the individual and by third-party organizations. We think that we will, through those mechanisms, start to collect more income tax because there'll be great integrity in the system. And then finally, which I'm hoping Dennis will talk a little bit about, is that we need to do more auditing of those people that have been named in the Panama and Paradise Papers, for example, or have been fingered in corruption allegations, for example, in the Zondo Commission. So thank you, Dennis. I'll leave it there.
The appropriate starting point, therefore, is, I think, to work out what are the needs which we have, and then to try and explore what the financing options are, rather than to start with some notion of what the finite envelope might be. We look at a sliding scale of a social security payroll tax like a UIF. If a BIG is implemented, it's important to note that all of those earning below 350,000 still come out with a increased income. So we then look at a selective removal of tax benefits to the wealthiest on pension funds and medical aids, which combined raise just under 40 billion. Increase in a dividend tax, which can raise an extra 10 billion. We then go on to look at consumption taxes and wealth taxes. So the implementation of a premium VAT rate on a basket of luxury goods, the minimal increase in a carbon tax to combined raise about 10 billion, transaction tax, which taxes rand trading, a increase in estate duty, and a minor increase in the security transfer tax, all of which raise relatively small amounts, but which would also move us to more in line with middle income and OECD norms, reduction in corporate tax breaks, particularly the ineffective employment tax incentive, and then just a limited reduction of wasteful and irregular expenditure. Not necessarily all of these are implementable simultaneously. We also look with a basic income at the share of expenditure on vatable items.
What is a helpful number is to look at the burden of the interest bill on the national budget. This is a structural macroeconomic model that takes into account the structural shocks both on the real economy and on fiscal policy. And what you see on the screen in front of you is the projection for the interest to GDP ratio. That's the public interest bill relative to the tax base for the next 2 years. The projection that you see is 100 simulations of our fiscal reality in South Africa, and it is not a worst case. It is in many ways a best case simulation. In red is the median of 100 projections for our interest burden over the next 2 years. The upper dotted line is the 75th percentile of the distribution, and the lower dotted line is the 25th percentile of this distribution. But at least in half of the cases, we can expect to have to deal with an interest burden of almost 8% in 2 years' time. There is almost no country in the world that can or has managed to sustainably pay 8% of GDP. We cannot spend more than a quarter of our public resources servicing the debt stock. We now have to deal with this problem, even though it is absolutely true that we have all of these important social problems to deal with as well. So what can we do? Our current tax base is already, in terms of structure, a developed tax base, and I don't think there is much gain to be made from the structure of our tax base. If you look in comparison with upper middle income countries, we have already a developed tax structure, both in terms of tax base, both in terms of structure and level. The multiplier impact of a large expenditure program such as a universal basic income will somehow generate the growth which Judge Davis spoke about that would solve this problem on its own accord. All the empirical estimates of expenditure multipliers on the fiscal side tell us that is not a realistic expectation to have. Those multipliers are not just a bit too small, they are vastly too small. So if it's not the multiplier, if it's not higher taxes, it leaves us the discussion on monetary policy, and I'm not persuaded that there is any possibility for us to solve the debt problem through monetary policy. The idea that the central bank can simply create rand balances to solve a fiscal problem is one that has been tried many times over in the course of the last century, in the sort of era of central banking, and the results are predictable, that you destabilize your currency, you destabilize it either in the form of domestic inflation or in the form of a currency depreciation, both of which lead to higher local interest rates and ultimately an unsustainable fiscal position.
A lot of jurisdictions that have got very, very high tax rates also have very high social wages, and they have very high and good quality education, healthcare, etc., which is definitely not something that we can claim. And I think these are things that we need to think about before we levy further taxes. So, one of the things that came up, one of the issues that came up in earlier discussion is that, you need to look at debt instead of looking at the overall debt stock of government when you're thinking about the constraints. You really need to look closer at the debt service cost as a percentage of expenditure. And this is definitely something that I agree with. But one of the points that also came up is that, you're sitting with debt service cost to GDP that are definitely above 20%, that are trending more towards the 25%. So to say that your level of debt is not yet a problem, I think is already wrong. You're already sitting in a very precarious position where, your debt stock and your debt service levels are already pushing the boundaries of what is sustainable. So for me, I think you already hit the limit as far as using, using the bond market to fund extra government expenditure is concerned. I know there's a lot of people that talk about, policy has got to be a little bit more experimental, and policy making is experimental in nature, but certain things have got fairly predictable consequences, and it would be stupid, to say the very least, to try and pursue, public policy measures that we know will lead to failure.
Let me just see here. This growth problem, this problem of South Africa's economic performance is a long-running problem, such that even when we're doing well, we are a perennial underachiever. And this has significant implications for what we can do with respect to poverty. We are starting to see a significant level of differentiation in the market. The market, I think, has grown wary of South Africa's persistent economic underperformance. So the idea that there are opportunities to finance new expenditure needs to be it needs to be approached with a pinch of salt, because we're seeing something quite different. We spend most of our budget on the social sector, on social services in South Africa, and more as a percentage of GDP than most emerging market countries. I've already indicated 56% of the budget is spent on social services like the social grants, education and health. The question is, all this money is there. How well is it being spent? Well, in a number of cases, not very well. Tax morality is a problem even now, and it's becoming a bigger problem because of this issue of what's happening in the state and the capacity and the poor administration and management and a kind of weird political economy. But it'll become worse, in my view, if we adopt a policy that says we are going to just increase the tax burden without solving the fundamental macro and microeconomic problems that we have. If we return government spending to the levels, the trajectory that it was on at the level of the February 2020 budget, without changing anything else permanently, we will have a full-blown fiscal crisis, and its impact is not going to just be fiscal, it'll have a profound impact on the overall economy. I do think that we have to be very, very careful, and we have to understand that we have a real risk as a country of debasing the currency. And such a scenario would put us on a path to ruin much faster than I think anything else.
Generally, it does appear to me that the rest of the panelists do not share your view that the kind of increase of taxes that you're advocating is the panacea to the problem.
The question is whether the current tax structure allows for various increases, which I think the answer is yes. I mean, in a numbers term, that's been illustrated. Also, let's avoid simplifications, which are just nonsense, like there is 6 million taxpayers. Everyone pays VAT, and a large number are employed in entities which pay corporate income tax.
And that COVID has kind of muddles up what might be called a long-term extrapolation. Is that what you mean?
That is exactly what I'm saying. The identification problem last year, given the highly peculiar situation, makes it very hard to generalize anything from the data from last year. And I would much rather look at the evidence we have over a longer horizon and we've had this fiscal stance for a much longer period, and you would have to ask yourself if the fiscal multiplier was indeed structurally so large in South Africa, why was it not large in 2017 or 2018 or 2015?
So I don't think we should ever let public sector officials off the hook when it comes to new tax proposals. And currently, because government officials belong to a defined benefit scheme, right, they're not contributing. So they have these very generous pensions that don't count as part of their salary, that aren't typically spoken about as part of the salary package. So how would you bring them into the net, Gilad? I'm interested in that point. So and of course this would be a massive disincentive for people in the private sector to continue contributing as they do to retirement funds. So if you take away this massive tax benefit that is currently in place, you will automatically reduce retirement contributions. That goes without saying.
When you do something on one place, it allows you more degrees of freedom on another. So for instance, if you did see labor market liberalization, you could probably borrow more money, so you could spend more. And it almost like the two will reinforce each other. So, you know, to look at fiscal policy alone without looking at all the other parts of the policy basket, it's not going to get you very far.
Whatever that new path is, policy changes and new government programs on their own are not enough. And in its current form, the state is not capable of delivering on our existing path, let alone a new one. And we need to rebuild the state to be able to at least perform its basic functions, like paying grants on time, or maintaining roads, or delivering education and healthcare. Rebuilding state capacity will not succeed if the abysmal state of politics, including party politics, is not improved. Public servants, municipal officials are rewarded for following the correct procedure, even if it results in no service delivery or no decisions. It's become procedural checklist rather than outcomes-based or deliverables that to the satisfaction of the wider society. And positive deviations, which form the basis of an adaptive management approach, where plans can be regularly adjusted and adapted based on new intelligence from the system and the environment, are not in any manager's vocabulary. And if the politics collapses, as we've seen in probably over 50% of our municipalities in the country right now, you can't rebuild the state. The resultant focus by managers is inwards to the institutional processes and procedures and upwards to politicians, auditors, and forensic investigators, rather than downwards to poor and vulnerable communities and outwards to society. The institutional culture is therefore unresponsive to and unsupportive of societal initiatives. The tragedy is, as we know, that all the rules, regulations, and compliance procedures have not prevented the abuse of the system. However, they have prevented good civil servants from engaging with communities, responding flexibly to their needs, and creating a more enabling environment, which is a starting point for tackling poverty and inequality. The experience of this frozen, stagnant, and largely unresponsive state system leads communities, business, and civil society to say, either join us in our own efforts or get out of our way. So, Chair, final point, in rebuilding the state to support a new development path, we need to address the regulatory systems and the toxic institutional state cultures that have emerged based on these systems. I would argue that the South African state at the moment and the way it is constructed in terms of its rules and regulations is unable to support or engage with informality, whether it's informal traders or community kitchens or food gardens and urban agriculture or all sorts of bottom-up community initiatives. Effectively, we've got a top-down authorizing environment that behaves in a very clunky way and prioritizes its own rules and catching other people out in breaking those procedural rules that splits it apart from the bottom-up mobilizing environment of communities, of entrepreneurs, of businesses, of innovators, of the rest of society, including academic research. There are models of connecting better between the top-down authorizing environment of the state and the bottom-up mobilizing environment of business, civil society, and academics and researchers.
And so if you've got an economy that's effectively the poster child, at least, I think one of the poster childs for being in a middle-income country growth trap, then there are challenges with respect to what the state can do. But effectively, you've got this problem of an economy that's not been growing sufficiently fast. And as a consequence, you then have minimal impacts on poverty and inequality. The key point I really want to make in this context is here's further evidence, right, of if we were able to, and I'll come back to this, if we're able to more efficiently and effectively disperse the COVID-19 grant, right, one could have reached up to 61% of the population through the pure COVID response. So in many ways, we have the makings of both a benevolent state, but I think, and it's the point I'll come back to, what we do not keep an eye on is the efficiency of spending. I'll leave you with one data point on social assistance, is that any number of studies by colleagues of mine and others have shown that we have one of the most optimally targeted towards the poor social assistance schemes in the world. In terms of the cost of disbursement, so how much it costs to disperse a grant in terms of administrative and other costs, we're one of the highest and most costly targeters of social assistance. So effectively, we're an inefficient spender of good money. Let's look at aggregate employment for the period, a lot of data going on, from 2010 to 2019, and think of the bottom as the total employment. So employment's gone up from about 13 to 16 million, but that's green circle's important. About 31% of all those jobs have come from the public sector. So what are the things that we can think about in terms of building this capable state, building a state that's more effective and more optimal in reducing poverty and inequality? Well, one of the things is to just focus on non-discretionary costs that are crowding out what I would call pro-poor service delivery. Transfer payments, the wage bill, and debt servicing costs take you to about 80% of all expenditure. So you basically have very little left for what I would call crowding in investment. So investment expenditure that's actually going to be pro-growth, that's going to give us that kickstart on the revenue collection side, on the growth side, that's going to allow for a larger cake to then spend on poverty and inequality reduction. You have massive improvements with the new regime at SARS in terms of revenue collection, but just remember that the other way, aside from growth, to improve the coffers of the fiscus is to improve efficiency of revenue collection. And it's not clear that we're at the outer limits of what's possible. And that's essentially where you can get gains without thinking about these the sort of ideological arguments about less or more expenditure and so on. Just spending better is better for reductions in poverty and inequality and improvements in investment expenditure. Finally, I think we need, as a society, to be more creative in involving the private sector in assisting the state with socially relevant interventions. Employment matching of the form that Harambee does, which is essentially a private sector initiative, right, is incredibly powerful in matching supply and demand in the labor market and reducing youth unemployment. And one can think of infrastructure provision, debt markets, and so on, where the private sector can be drawn in.
The issue therefore becomes, in the redesign of the state and its institution, as well as the theory of governing and governance, do we take into account these, the challenges and all these competing, issues that are there in society? Because whilst we may be so excited about 4IR and the fact that we can digitize services, to what extent are you excluding or are you including? SASSA was able to process more than 5 million applications, pay more than 3 million grants. During that period, more than 60% of employees at SASSA were at home. during that period when they were processing those applications for the 350 grant, which says something about the ability of the institution to go through a digital transformation path. However, the caveat is in the next 5 years, as I argue, 50% of employees of that one department are going to be redundant. On what basis then do we lay a claim to the idea that we are a capable state, we will achieve the NDP goals by 2030, when those who are doing modeling on a daily basis are actually projecting that we are going to become a failed state? Fortunately now, the state has realized that state capacity matters, and that is why state building state capacity is the #1 priority. You cannot build an economy, reverse poverty and inequality unless you've got capable men and women and institutions that are geared towards delivering on the promise of reversing poverty and inequality. And of course, you've got to be efficient, you've got to be ethical in the manner in which you are doing it. Now, lastly, I make an argument amongst public servants. This is what I call a 10 thesis of effective public policy. And it is important that those who are involved in the craft of writing policies dealing with poverty, inequality, employment, and so on must deal with this thing. And where I say it because we've seen many instances where what people think is a good policy end up missing the mark or not having any desired impact. Vision matters. It's got to be evidence-driven. So all these scholars who are here, every day you are involved and engaged in the labor of producing evidence, that this evidence must permeate in the process of policy making, and that as part of building state capacity, it is the capacity of public servants elected and appointed to effectively and dynamically use evidence to make quality decisions. And obviously there has to be well-governed institutions. This idea of omnibus policies, I think, must come to an end. It doesn't work. You are unable to measure even the impact of those. And most importantly, that we must be able to communicate. The issue is there are good policies that end up not being communicated effectively, and then the results are not known. One of the things that South Africans public service actually must liberate itself on is this idea of being married to an idea, even if it doesn't work for as long as it's going to be. So we've got a very abusive relationship actually with some of the policy decisions we've made. If post the pandemic, we go back to a same policy path we were on, the same manner in which of delivering services we were using before, it means that these pandemics, and their effects, they become endemic in society, and therefore history does matter.
And in my view, in the case of South Africa, we've seen the hollowing out of key capabilities over a long period of time. Only has got worse in the Zuma years, but it certainly didn't start there. So most recently through state capture, an obvious case of hollowing out of the state. But well before that, through years of privatization, and here I refer to privatization in all forms, not just the direct selling off of state assets, outsourcing, rolling back of the state, tenderization, budget cuts, the lack of capacity building in the public sector, fragmenting through the agentization of the state, over-reliance on consultancy firms, weak provision of public services, and really the lack of an active public role in various domains that, in my view, would belong squarely within the role of the state. So I think all of these have hollowed out state capabilities and the ability to deal with both old and new challenges. State capabilities I see as dynamic and, at least to some extent, as endogenous to what a state actually does. So these sort of capabilities, I think, are largely built up through learning by doing. Only training and so on can only go so far. It's only through actually doing that these sort of capabilities can effectively be built up. And included within that is failing and learning from failures. But in terms of reducing poverty and inequality, I actually don't think it's a lack of capacity or lack of skills in the public service. It's actually a political issue of political choices. It's not as though government could just solve poverty and inequality if only we had better trained public servants. We simply haven't made the choices and the decisions to deal decisively with poverty and inequality. I think, in my view, poverty is in some ways easier to deal with than inequality, and certainly than unemployment, because the state has more direct levers on poverty than in the case of inequality as well as unemployment. And I would make a bold claim that it's within the state's reach, our state, our South African state in this current period, to virtually eliminate extreme poverty, and even to a large extent broader poverty, even through direct transfers, such as a basic income grant. And we can debate at length about the financing, about pros and cons, about different options, and so on. And I don't want to be simplistic here. Obviously, nothing is for free. But let's also not pretend that the state doesn't have the power to not only reduce, but even to virtually eliminate at least extreme poverty to all intents and purposes. It's been done in countries that are much poorer than us, and arguably that have even weaker state capacity than us. And not dealing with poverty and inequality in such an extreme case such as South Africa, I think brings myriad other problems, social and economic problems for growth and development. And the fallout from extreme poverty and inequality, I think, is more difficult and more demanding for a state to deal with than actually dealing with poverty and inequality at source. Without being simplistic, but I really do think that it's a question of political will as to whether we opt to deal decisively with poverty and inequality. So I think in the first instance, let people not be hungry, let people have at least enough funds to travel, to look for work, or even to have the energy to start thinking about starting a small enterprise, even if informal. I think what's clear is that when levels of poverty and inequality are as extreme as they are in South Africa, the poverty and inequality are themselves constraints on growth. So they're not just things which need to be addressed because of its right to do so from a human perspective, but even from a narrow economic perspective, it would be difficult to grow at sustained high rates without addressing these. They are actually inhibiting our growth as it stands.
One is to keep an eye on whether the sort of cost of additional state expenditure is being financed through debt, right? And I think that's the balancing act that you've got to get right. Now, instead of sort of ideologically viewing that, it's just sort of the way in which finances and fiscal policy happens. I mean, I think it's interesting that the data would suggest that we are an incredibly benevolent state as it is already. Now, the question about whether one then looks at an additional expenditure that then drives the good things, the reduction in poverty, reduction in inequality, and employment generation, I think is the critical one where we're trying to think about. And I like the point from Mbeki about, well, what about the informal sector? It seems to me that if you're thinking about sustainable employment opportunities, if you're thinking of poverty reduction in a sustainable way, that's not dependent, at least in the long run, on the fiscus, then creative mechanisms for supporting the informal sector, for micro enterprises. We somehow seem to think that the private sector is a swear word in these debates. We get into log jams around sort of state expenditure for expanding of the grants, and then it sort of gets wrapped up in admittedly important campaigns, right? And I think they have a space and an important space. But how about the really long-run sustainable forms of employment generation through micro enterprises and in the informal sector?
So the state is one of the biggest buyers in society. The state buys from small things as pens up to very sophisticated medical equipment. And besides the state as a buyer, the state also provides support systems, including infrastructure for those who want to do business with the state or to trade on their own, for them to trade in an environment where they can thrive when they do so. So there has to be some kind of a review in a manner in which the bylaws are being implemented. Otherwise, you will displace so many people, because as it stands now, many people are trying to eke a living by selling and working for themselves. And if you strictly apply the bylaws because you want a clean city and so on, you are going to displace people and will plunge men into poverty. So there's a lot more capability that might be built amongst colleagues who are in the supply chain management environment, so that the support they provide to the small businesses and including to the SMME sector is different from the manner in which it is being applied, because as it is now, it favors the mites, those who've got capacity to produce certain documents and to negotiate complicated contracts, and the small producers end up then losing out at the end of the day.
Is the issue perhaps that we're not wanting to deal with poverty reduction sufficiently, rather than that we don't know how to go about dealing with poverty reduction?
The issue is so complex and the positions are so diverse that it's difficult to find a clear argument of what we should do. How do we deal with a debt problem and at the same time deal with the poverty problem? And I think this is the contested issue that is, in my mind, on the table. The importance of growth to have a tax base and have more taxpayers, more people in the workforce that can help that process of the revenue stream. But at the same time, how do you lower your debt so that you have a sustainable way of funding the poverty programs, poverty alleviation programs that we all think is important?
I mean, we see, for instance, the data coming out of NIDS CRAM waves that show that it's not just a current crisis, but it has future implications. So the huge dropout of kids from school, often because hunger prevents them from having successful interventions. Over half of the unemployed, the formerly unemployed, haven't finished matric.
But the level of poverty that we're dealing with, the level of, for a high income, what they call it, country, it's intolerable. I mean, that has to be the basis, and requires that our economists have to shift their thinking. You're not going to achieve a Chinese, a Vietnamese growth rate if you don't think differently.
And Georgina Ryan also has made a comment about getting over, if we get over the tyranny of the log frame, how do we achieve coordination between government departments? How do we ensure that departments that have overlapping mandates are able then to work together?
If it's just about ticking the box, then the task that we have confronting us is far more, considerable than we often tend to think. Because we tend to think, there's policy proposals, policy options, and policy implementation. But if the institutional culture, by regulations intended to prevent corruption in the first instance, that has had what sociologists would call unintended consequences of undermining, what they call it, creative thinking.
One of the take-homes from the engagement was a sudden aha moment as participants, including presenters, understood the challenge of what we were trying to do through this approach, which was to use science to guide policy and to be able to see the benefits of using a much more kind of constructed analysis was something which gave people freedom to start thinking in a different way.